you've got the latissimus dorsi, runs from the lumbodorsal fascia, and it comes up here and it inserts on the humerus. And then just superficial and anterior to that, you've got the trapezius. It runs up here all the way out to the clavicle, or excuse me, the scapula, and it goes all the way up to the base of the skull. So this large triangular muscle there, okay? On this side, we've got the trapezius dissected out of the way. So you can see the muscles that are on the external surface of the scapula. So this is the spine of the scapula, that little ridge of a bone. So this is the supraspinatus, the infraspinatus, and then hanging off the bottom down here, you've got this little round muscle, that's the teres major, okay? Then if you take those two forelimbs and put them together, you can see these muscles running from the spinous processes of the vertebra out to the scapula on both sides. Those are the rhomboids. And then you can also see them just deep here going up towards the temporal bone. These are the splenius. So the rhomboids will retract the shoulder blades like that, whereas the splenius will either rotate the neck or extend the neck if they both contract at the same time. And then up on the side of the head, you always want to use your external auditory meatus as your reference point. So the one just superior to it, that's the temporalis. It goes underneath the zygomatic arch and attaches to the mandible. And then the one here, you can actually feel the zygomatic arch, this large ball of a muscle, that's the masseter. It originates from the zygomatic arch and it inserts on the mandible. So the masseter and the temporalis both cause elevation of the jaw. It's like you're biting down on something. And then the antagonists to the masseter and that are these V-shaped muscles that you see here. They originate back here on the mastoid process as an insert on the mandible. So they are V-shaped and they elevate as if to lower the jaw to open it up. So digastrics open the mouth, masseter and temporalis close the mouth. And then you have these muscles here running from the sternum of the cat up towards the mastoid process. You see them on either side. In the cats, they actually have two. They have a sternomastoid and a clitomastoid, but we just call them sternomastoid, or you can call them sternocleidomastoid. In humans, they have two heads down here and they come to one insertion. And then this large triangular muscle here going all the way out to the elbow, that's the pectoralis group. You pull that back, you can see the biceps brachii here, which causes the flexion of the elbow. And then just below that, the triceps goes into the olecranon process, causes the extension of the elbow. Then on the side here, you can see it looks like a large fan originating off of each rib, has that serrated appearance to it. That's the serratus ventralis. It originates on the ribs and inserts on the scapula, so it brings the shoulder forward, like to protract the scapula, whereas those rhomboids we talked about earlier retract it. And then if you pull the pec group down, you can actually see the cartilage there to the ribs, and the meat in between there, that's the intercostal muscles. And then you come on down here and you can see the external oblique with the fibers running down at an angle like that. Pull it back. You can see the, hold that, thank you, Arun. You can see the internal oblique coming back at this angle. And if you pull that one back, then you can see the transverse oblique going back at that angle. And they all run into the rectus abdominis here that runs from the pubic bone up to the xiphoid process. Okay. So then getting down into the legs, we'll flip over on this side because it's dissected. You can see this large triangular muscle here, that's the gluteus medius. Then you can see this thin one here, that's the gluteus maximus. So they're big and smaller in the cat because the cat's leg walks like this. But in humans, the medius would be smaller than the maximus. So gluteus medius, gluteus maximus, and then this large one here is the biceps femoris. Now, if you look at the anterior side of the leg, you can see the vastus lateralis. So if we bring this around like this, vastus lateralis, vastus medialis, then this deep one that runs around the femur, that's the vastus intermedius, and then this one that runs down in the middle of those threes is the rectus femoris. So lateralis, medialis, intermedius, and rectus femoris, that makes up the quadriceps that extend the knee. And then you have the adductor group, which is just deep to the gracilis, and they both add the leg towards the midline. But if you pull the gracilis back, you can see the semimembranosus, you can see the semitendinosus because it comes to a sharp tendon. Those two, plus your biceps femoris, are the hamstrings. They cause the flexion of the knee. Then you have the sartorius, which is a real broad muscle in the calf that covers up the quadriceps. It helps to twist the knee towards the inside, sometimes called the Taylor's muscle. So when you go to cross your legs, that allows that medial rotation. And then underneath there, you've got the gastrocnemius, and just deep to it, the soleus. Those make up the calves. They come together to form the Achilles tendon. They cause plantar flexion. And then on the anterior side of the shin, you have the tibialis anterior. It causes dorsiflexion. So the tibialis anterior, gastrocnemius, and soleus, those are antagonistic to each other. That's it.